tell you what, you know, as somebody said earlier, I think Dr. Ocala said, these patients have been abandoned, right? So we go into the rooms and we try to give them hope, but the people that are there with them 12 hours in and out, and longer than 12 hours, are our nurses. And I have seen such heroism in the nurses, so I want to thank you all. All right, and now, without further ado, Brian Tyson, Dr. Tyson, all the way from California. He's one of our heroes. He's been treated over 7,000 patients with COVID, and I'll let you tell his story, or him tell his story. Thanks, Brian.
Thank you, everybody. Thank you for having me here. It's been amazing to see all of the faces, the attention. How many providers do we have in here? Raise your hand for me. Okay, great. So I'm an outpatient urgent care doc. I had worked for an ER for about 14 years, found my niche. We started an urgent care in El Centro, California, in the middle of the desert, right on the border. Small town, but large population just on the other side. A lot of retired individuals there. So when COVID was coming around, I knew we were going to be in trouble because there were 2.5 million people in Mexicali. We're in the middle of a desert, and the biggest tertiary center is 90 miles away. 90 miles. We had 2 small community hospitals. So like many of us, I took it upon myself to do my research. My treatment protocol came out right around the same time Dr. Zelenko came out with his. And the hydroxychloroquine protocol treatment started with the 2005 SARS chloroquine article that was published, where it said chloroquine is a potent inhibitor of the SARS coronavirus and its spread. That's where we got our basis. The protocol developed through the year, and so I'm going to tell you what I use and how I address these patients. Number one, we saw everybody in person, so I got to see them face to face. I'm a face-to-face doctor. I'm not a telemedicine doctor. I have to see disease for myself. So those who presented with basically just upper URI symptoms, cough, not really cough, but more runny nose, headache, fever, those patients got hydroxychloroquine. We started them on 400 milligrams twice a day on day 1. And then 200 milligrams 3 times a day, day 2 through 5. That's number 1 drug. Number 2, we gave them Zithromax or doxycycline. And number 3, we gave them zinc. And the zinc was either the zinc sulfate, the 220, or just regular over-the-counter zinc 25, and we gave that to them twice a day. We also used vitamin D3, 5,000 units a day. Vitamin C, 500 milligrams twice a day. And we started using N-acetylcysteine, NAC, okay? 600 milligrams a day. That was the foundation of our treatment. That's what it started. If patients had pulmonary symptoms, if they had the chest pain and they had the shortness of breath, we did chest x-rays. We found early on that the chest x-rays were positive for inflammation. So what did we do? We started treating the inflammation. So I gave them 6 milligrams of Decadron, and we started them on inhaled budesonide in the nebulized form. I wanted to stay away from the systemic treatment because I didn't want to really suppress their immune system, but I wanted to treat the inflammation. So that's why we went to the nebulized budesonide form. And amazingly, what happened was we found in 2 to 3 days, 99% of our patients were better. Wow. Right? We brought them back. And it's something that I've always done. I bring patients back every 2 to 3 days until they're better. So day 2, day 3, they're coming back. Chest x-rays are improved. Oxygenation saturation is improved. Fevers are now gone. Headaches are now gone. Then we did the standard, it was initially 14 days, come back. And we had these little serology tests that we were able to purchase. And we proved that they had IgG or IgM at the time. And we said, okay, your symptoms are gone. It does look like a true positive COVID case. And we let them go back to society. That's been replicated now 7,000 plus times between me and Dr. Fareed. When we looked at those patients who started treatment before day 7, we have a 0% mortality with 1 hospitalization. If we started treatment after day 7, we've had 4, I think now maybe 5 people have passed, and we've had 8 hospitalizations. But what we've noticed is because we're the only treatment center basically in our area, we started getting sicker and sicker patients. So the treatment also needed to go and be extended at times. So my providers, I want you to understand, it's not just a 5-day one and done. Sometimes you have to extend treatment. Sometimes you have to reevaluate people. Sometimes they're going to need oxygen. Sometimes they're going to need additional medications. You saw from the list from Dr. Corey, there's a ton of medications we can use. And one that's not been talked about, I don't think here today, is Singular. So Singular being a leukotriene inhibitor, and we use that a lot with asthma patients, okay? With those pulmonary symptoms, I started using Singular at night, 10 milligrams, okay? And that also showed a significant improvement in their oxygenation and pulse oximetry. Aspirin is a standard that I think everybody should be taking. So aspirin, I think I forgot to mention that. Everybody gets 325 of aspirin if you're an adult, 81 milligrams if you're a teenager. Yes, I'm giving aspirin to teenagers. It's a little, against practice per se, but it's not. Reye syndrome in teenagers basically doesn't happen. So the moral of the story is, look at the symptoms, treat what you see, and use appropriate drugs for those treatments. It's not a diagnosis of COVID. It's a diagnosis of inflammation. It's a diagnosis of pneumonia. It's a diagnosis of hypoxemia. It's a diagnosis of a febrile illness. It's a diagnosis of nausea and sometimes vomiting or diarrhea, hydration. Giving people IV fluid has made a big difference. Getting people monoclonal antibody early on in treatment is also recommended and has been shown to have a huge improvement. So I've seen from 2 months to 102 years old, I've seen unvaccinated to vaccinated to even booster vaccinated positive patients. But the one thing is they all respond to treatment. And I think that's the biggest lesson that I want to make sure that everybody hears. Early treatment is so crucial, and they need to stop blocking us from saving people's lives. Thank you.
Awesome job, Brian. Thank you, Dr. Tyson. Dr. Buckminster.